All right, good vibers. So next we have an interview with a good buddy of mine, Danny. Danny's a van lifer, lives with his girlfriend, Lindsay, and he's also a traveling nurse. So he has been put in the middle of the thick of things the last few weeks. And so we're going to bring Danny on to give a little bit about his perspective and how we as van lifers can do our part. So Danny, how you doing, brother?
Doing very good. How is everybody?
Good, my man. Real good. Where are you, you in your van now?
Yep, in the van here, close to the hospital in Southern California. Just having a nice
Gotcha.
day off.
So how long have you been at that spot working in that hospital?
I've been here since November. I took a contract. I was up in Oregon prior and came down to LA. Just wanted to be somewhere warm, do the beach thing, and took it in November. It's a 3-month contract. Ended up extending. Goes until the end here of April. So I only have a couple more weeks or a week or so.
Yeah, so let's get into that because I'm very interested about your experience. I know that you have certain time periods where you're on and then you're off and you come back, and sounds like you left one situation and came back into a totally different situation. So I would love for you to share.
Definitely. So basically, the way that I've been able to schedule my shifts at this particular location was work a bunch of shifts, have a bunch of time off. We only work 3 days a week on this contract. So I was able to work 6 days in a row. So that's 2 weeks of work just bunched together. And then I had 8 days off. Went to Mexico, had a good time. Me and Lindsay went down and just had a blast, came back. And now this, keep in mind, this is during a period of time a month ago where everybody knew that coronavirus was a thing in Washington, New York, and didn't really see it down here yet, but there was talk about it on the news for sure. Not much talk about it amongst the hospital. Didn't really hear anything about it. I get back from this 8-day trip. Literally, I walk into the coronavirus unit, the dedicated hospital coronavirus that unit. That's my unit now. So it was pretty scary. They were telling us what you've heard a lot probably on the news. We're using one mask all day. And so that's not what we were trained and taught our whole career. It's, this is a one-time use thing. You're going to use it until you leave the room. You're going to take it off and throw it away just like a mask. Just like gloves. And so that was pretty scary. And we knew this is a new virus and there wasn't a lot of research on it. And so, what are we going to do? Say, no, I'm out of here. I'm going home. I'm not going to work and quit, or go with it. So we just stuck together and started working that day. It's been a month now and things have changed.
Yeah, that's wild, man. I can only imagine getting such a quick shift in your perspective. Now, where is the current status? What are we looking at? Give people the reality of what is going on right now in the medical industry in your world.
Okay. So in the beginning, it was a lot of rule out cases, meaning that the patients would come in with symptoms or similar to what these chief complaints are, which is shortness of breath, cough, and fevers, or they knew somebody that got tested positive and they were around them. So they would come in, and we had a lot of these rule out cases waiting on the test results. That's what I had for the first couple weeks.
Okay.
There were confirmed positives as well at that time at the hospital. But here recently, in the week and a half, 2 weeks prior to this day now, I've been taking care of positives. So it's definitely increasing. I had patients that haven't had a lot of symptoms, and I have had patients that have had a lot of symptoms. And when I say symptoms, usually it's a breathing issue and a shortness of breath and an oxygen demand where they're needing supplemental oxygen through the nose. And this whole virus is weird because we're not doing our normal practices of, okay, you need 5 liters of oxygen. Oh, now you need 6. Oh, I will do 7, 8, 9, 10, 11, up to like 10 basically on this normal nose thing you see on TV a lot in the
Yeah.
hospital shows. We're skipping that because supposedly we're getting new research and keep this in mind, all the research we're getting now, it's not very conclusive. It's all young. It takes a long time to get good evidence.
We knew
But they're
about this
saying,
virus, what, 3 months ago? It wasn't even
yeah,
in
it's like
existence 6 months ago. So yeah.
supposedly over 6 liters nasal cannula, it's turning into airborne. It's aerosolizing it and making it go into the air to where if you're not wearing an N95 or that kind of device, you could possibly get it just by being in the room. So that's pretty scary, and none of this is all 100% guaranteed. So a lot of PPE, which is personal protective equipment, changes in policy over the past 3-4 weeks. And that's, it makes it scary,
Yeah.
that, you start doubting, is this going to be okay for me? Am I going to get sick? Am I going to be one of those people that need to be ventilated? Am I going to be okay if some of these people aren't getting sick?
Yeah.
Just
Now, that's a great question. I mean, interrupt you, but are you seeing anyone that was on the medical side that is now being treated?
Not physically in our unit or anything like that. We have had sick calls recently, but I don't know of anybody actually having it and coming positive that's having to need any that type of care.
Yeah, because that's the scary part, right? You go from trying to be able to take care of people, and then you lose all of your staff. That's the worst case scenario, right?
Exactly.
Yeah. No, I always have a lot of respect for people in your industry, and let me take this opportunity to thank you on behalf of all van lifers out there watching this show, and people that realize and appreciate the time and the effort that not just yourself but so many people are putting in for the greater of humanity. So
Well,
big,
thank
big,
you.
big.
Yeah, it's a pleasure to be able to actually do something and to not have lost my job and to be able to do something about it.
Yeah, for sure. So what can we do as nomads? We're used to self-isolating. We are used to times out on our own in the middle of nowhere. But from your standpoint, what can we as fellow nomads do to make sure that we're doing the best thing for you guys in the field?
Yeah, good question. I mean, everybody's hearing about the social distancing thing. And, for anybody that hasn't figured out why, based on a lot of the spreading of the news, is basically we have only a certain amount of ventilators, a certain amount of nurses, a certain amount of doctors, a certain amount of patients, rooms, to where if everybody gets sick at the same time, we just won't have all the resources. That's kind of the gist of it. The whole flattening of the curve thing. If too many people get sick too quick, we won't have the resources. We will literally have to decide who gets a ventilator and who doesn't, basically meaning who's going to live and who's going to die. That's the worst case scenario there. And that's just
Jeez.
nothing. That's something that nobody wants to be part of.
And do you
So
talk about that? Like, are you guys actually having this kind of discussion when
I'm
uh, when you're on your
current,
shift?
Well, currently I'm not on in the ICU where they're doing ventilators, but on my step down unit, they're actually training the staff to learn the basics of ventilators to where maybe if it gets too many, if there's an influx, of them that they might have to take ventilated patients. So I'm sure the talk will be here eventually. Hopefully not. Hopefully we have done a good enough job of staying at home and isolating to where it prevents that.
Yeah, but I wonder if it's going to be that way. And then I also wonder about the uh, ventilators. I've been hearing ventilators, very difficult to come by, take a lot to produce. And I saw in Italy where they were using the containment masks. Are you seeing any sort of uh, alternative to ventilators, or has that discussion been around at all?
Not on my first facility. They have enough ventilators currently, so I haven't seen anything or heard anything like that yet. But definitely, I've seen some pictures like what you're talking about on the internet as
Yeah.
well.
So as a van lifer, what can I do? What can we do? For you guys, I'm staying put. I'm self isolating. What are those next steps that I can do?
So, number one, like we were just talking about social distancing. Let me turn off my heater here. It might be a little too loud. Sorry.
No worries.
So, it's not just about um, people with illnesses that need to social distance themselves. It's everybody, and 6 feet may not even be enough. They're doing research right now that may even suggest that this stuff is going airborne, and it's not just from a sneeze or a cough. It could even be possibly transmitted from talking.
Mm.
So, the best thing that we can do is just stay home or, minimize our going out to go grocery shopping, getting gas, those essentials. If it's not essential, try to cluster these things together. They're only allowing you to maybe get a few items when you're at the store. do your best to try to grab as much as you can that you actually will use. Don't hoard. But that's one thing to do. Another thing that's huge is don't rush to the hospital if you're having some little symptoms. The main symptoms are shortness of breath, coughing, and fever. If you're having any of those symptoms, maybe call your primary care physician. Maybe if you do have insurance on the back of the card, there's a number that you can call to try and do the 24-hour nurse hotline. I know my card has that on there, which is a pretty good resource. You can call them. They'll be able to help you figure out, is your situation severe enough to where you need to go to the hospital, or are you okay? Like telemedicine, telehealth, if you guys have heard of that before.
Yeah,
And
for
for
sure.
those of you who don't necessarily have insurance, I personally haven't researched and figured out what to do in this case or situation. So that would be something I would look into.
Awesome. No, it's definitely something that I'm interested in. I know that I just switched my healthcare to Oscar Healthcare because of their telemedicine. But to be completely honest, I haven't gone that next step to set it up. So I'll use this as an opportunity for me to go back and look at mine, but also anyone else out there, check your healthcare providers' information. Check where your hospitals are. So in network versus out of network, guys, that's huge. And if you don't know where your in-network hospital is, that could be a huge detriment payment-wise after the fact. So do the legwork ahead of time. It'll save you thousands in the long run.
Good advice.
Any other advice or how you see the future of this, and like maybe one good thing that's going to come out of this whole situation?
I still have a couple more things that I think that might help, especially the vanners with
Please,
the
yeah.
whole, suggestions. And
Hmm.
that would be like, we're already isolating a lot. Being in a van, a lot of us are away from society and stuff a little bit more than the average Joe, which is helpful in trying to prevent the contamination and spread of this. But going to places like BLM or like desolate areas may pose a problem for other people. For example, the communities, if you're going out to a BLM land that's hours and hours away from a good hospital, if you ended up getting sick, you might be too far away or not feel good enough to be able to make the trip to get there, which would be, not good at all. Another thing with the whole BLM land is maybe there's some small towns around it. Maybe they don't have maybe they do have a hospital. Maybe it's real small though, and they only have 5 ventilators. And, if you got sick or you were there with a couple buddies or something and they got sick and you guys had to go there, maybe you would be one of these people that wouldn't be able to get a ventilator and they'd have to, or maybe you would be taking one away from this guy over here that lives here's grandma. So
Hmm.
those are just a couple things. Maybe the grocery store, it doesn't have enough for a big population of vanners and stuff being in the area as well. Maybe so limited resources. They don't have a lot of that. And so that's one reason to maybe try to reduce going to BLMs and to try to be closer to healthcare systems that are big enough to handle you.
For sure. And where can people find information about that if they're wanting to know, is this a good area? Because I'm on BLM land as well. So this is something that affects me, and I'm interested in making sure that I'm doing the right thing.
I'm not sure. I mean, I guess the first thought that I have is maybe Google it, see how many hospitals
Sure.
are in the region. And then they all have websites and you can go and see how many beds and how many, is it a dinky little hospital that's only got 50
Hmm.
beds or is it hundreds? That's one way to tell. There's not a real black and white answer for that for me to give you.
Yeah, no, I totally get it. And I think that's the important thing, is just to understand that we've got to be making some of these decisions, ahead of time, so that when we're in a situation and it could be dire, we have a plan and we're prepared. So I want to thank you so much for taking the time to actually come and meet with us, Danny. Thank you so much. I'm going to flash your Instagram and YouTube up there so people can come check you out and say hello. And if you have any other shout outs, we're going to wrap this up. But again, I want to thank you so much. Our video is going to be replayed on our website, thegoodvibecollective.com. So feel free to check that out as well. And you can check a replay or send it to someone else.
All right.
All
Well,
right,
thanks
Danny.
for having me. Had a fun time.
Appreciate it, brother.
All
Take
right,
care.
take it easy, everybody.